Hello, everyone. Thank you for joining us today for this Lunch and Learn presentation from the Osteoarthritis Action Alliance. I'm just going to give a brief word about functionality before we get started. Everyone should be muted for today's session. We will have a question and answer period at the end of the presentation, which will take place in the chat box. Should be on the right of your screen. If you have a question for our speaker, you may type the question into that box at any point during the session, but we will read them all aloud at the end of the presentation for discussion. We are recording the session today, and we'll be posting this webinar on our website as a free resource for you to share and with colleagues, patients, or just to revisit at a later date. It will also be archived on our YouTube channel. With that, we will go ahead and move forward with the presentation. So thank you everyone for joining us for our presentation this month. On September 18th, 2019, our presenter today is Ben Smith, and he's the Director of Didactic Education at the Florida State University College of Medicine School of Physician Assistant Practice. He also practices clinically as a physician assistant in rheumatology at the McIntosh Clinic in Florida. Welcome, Ben.
Well, thank you. And I appreciate that very kind introduction. And I'm grateful for the opportunity to spend a bit of time with each of you today in this setting. I'm grateful to the Osteoarthritis Action Alliance for being asked to share a few things with you today that certainly have my interest. And I hope they'll be beneficial for each of you as well. Looking back at topics previously presented, this is a little bit of a different type of topic. But I hope that you'll find it applicable in the setting where you find yourselves. We'll speak today about preparing nurse practitioners and physician assistants to enhance the arthritis workforce. And even though we'll be speaking specifically about nurse practitioners and PAs, the principles I hope that you'll find to be practical and can be used with as you think about if you have an educational responsibility, a teaching responsibility for other health professionals as well, as we strive to address the needs of public in regards to treating arthritis and specifically osteoarthritis as well. As was mentioned, my clinical background is in rheumatology, and in our practice, we certainly do treat patients with osteoarthritis. And so I'll share some of that with you as we move through the presentation this morning. As I thought about what we should do in a very focused way, succinctly, you certainly may be aware of the workforce challenges faced in caring for those with osteoarthritis and other rheumatic diseases as well. So we'll briefly describe that. We'll recognize and provide a background about nurse practitioners and physician assistants. Interestingly enough, both professions are just over 50 years old. And there still is a lot of, if you will, marketing or things that we should do to educate the public and others about the roles that PAs and NPs can have as healthcare providers in various settings, including settings of caring for those with arthritis. And then the real statement of today is, what do we do about it? And I'd like to present an approach that had the privilege of helping with, that was really spearheaded by the American College of Rheumatology to help affect the use of NPs and PAs in the arthritis workforce. So when we think about the U.S., we recognize, and I'll share with you that there are tremendous workforce needs that exist in our country. You know, lots of reasons, lots of variables play part in those workforce challenges, including the workforce supply and then the demand that comes because of the aging population and the growing population and the recognition of these conditions such as osteoarthritis. This is an image taken from a study done by John Fitzgerald just a few years ago, and each of the dots spread across the country are meant to represent locations where adult rheumatologists practice. So if you look at this dot way down here on the Georgia-Florida line, that's our practice there. But if you look, I think there's some observations that you can make about this. The areas of high concentration, if you think back to your geography, certainly relate to large metropolitan areas where there are supplies of rheumatologists. However, you notice that across the country, there are many wide open, in this case, yellow spaces, where there is a lack of adult rheumatologists. And you think about the need of patients that drive or travel to see their rheumatologist when that's needed. And that, again, represents what the challenge is for us from a workforce standpoint. Now, I didn't include, based on the purposes of this is an osteoarthritis discussion, I didn't include today the pediatric map, which looks similar, although fewer dots on it as well. The other point that I would make is if you look at Canada, our neighbors to the north, the map of distribution and supply of adult rheumatologists is very similar, concentrated in large metropolitan areas, but large areas of space where we would find areas that would be considered underserved. This was further clarified in a couple of publications that were done in the last 15 years. One based on the rheumatology workforce in 2005, and then more recently an updated publication in 2015. And it's fairly simple to see, but the yellow and green lines here plotted represent the expected supply and demand gap that was projected by the first study published in 2007, representative of what was expected to be the workforce based on 2005 numbers. And you see, this is, even then, we recognized by 2025 there was going to be a supply and demand gap for adult rheumatologists. And again, this plotted for pediatric rheumatologists would look very similar. And then just last year, we published additional data in this regard, but you notice that this supply and demand gap is larger than was anticipated when we look toward the next decade and the supply of adult rheumatologists. In fact, if you do the math here, you come up with a projected gap, a projected need of an additional almost 5,000 rheumatologists. And if any of you are in a training setting, you recognize that is truly a tall task. Now, we who work in rheumatology and who care for persons with osteoarthritis and other arthritis, you know, none of us lack for work. There's plenty to do. There's much to be done. But this is a tremendous challenge that we must consider. In response to the 2005 data, the ACR considered several things that could be considered to address these workforce needs. The first was to increase the number of rheumatology physician fellowships, and that has been accomplished, but is meant to represent one part of the solution for this supply and demand gap. It was also secondly suggested that improved practice efficiency is something that should be considered. This was at the time when EHRs were really taking a strong hold and suggested that, you know, could this be one way of improving practice efficiency? Other things were considered as we, you know, align with our practice managers and coders and billers and things such as this. Other elements could certainly be considered as well. The third bullet, which is pertinent to what we'll speak on today, is this suggestion that the PAs and NPs could be utilized in rheumatology practice to enhance the workforce. Using PAs and NPs with their knowledge and background, their training to come and assist practices in meeting the needs of patients with rheumatic disease and patients with osteoarthritis as well. So this was wonderful, and you know, I'm happy to report that those efforts have occurred. But if we go back and think about that that need of nearly 5,000 additional rheumatologists, all of these factors must be considered and must be applied. So a brief background to establish firm foundation for all of us. Again, the nurse practitioner profession really became formalized in the mid-1960s, primarily focused in Colorado with a pediatric program at that time. The profession has grown significantly. As we recognize it in the U.S., approximately 270,000 nurse practitioners have been identified. Nurse practitioners with their training, which is in the nursing model, really do help patients in a very holistic way in terms of evaluation and diagnosing, writing prescriptions, ordering tests, etc. Nurse practitioners have the ability to provide comprehensive care to patients of varying ages. Another thing to highlight about nurse practitioners to share with you is when someone attends nurse practitioner school, they have the opportunity to choose a specific area of focus. And in this third bullet point, I've listed the potential areas of focus that could be considered for nurse practitioners. And again, the interesting thing, the reason I share this is if you look across these various settings, really almost all of these settings would provide an opportunity for that provider, that nurse practitioner, to see someone with osteoarthritis or osteoarthritis symptoms. And the importance to address those, of course, we certainly recognize. This list also represents the opportunity to be trained and prepared to help meet the needs of persons or patients across the lifespan. Certainly in those times of life when osteoarthritic symptoms may be prevalent. So in a very quick summary, that's who nurse practitioners are. Similarly, the same could be said of physician assistants. Like nurse practitioners, PAs, the profession became formalized in the mid-1960s at Duke, is where the first class matriculated, based on some work that Dr. Eugene Stead, who was a family practice trained physician, but he really gave birth to the idea of this profession. Now, there's approximately 131,000 PAs in the country. PAs are trained in the medical model. And like nurse practitioners, PAs receive their training and are nationally certified and state licensed. So both for PAs and nurse practitioners, there's certifying exams that happen based on a national level. But the scope of practice for both is determined at the state level based on state laws and can be based on practice-specific needs. And we'll focus about that a bit more as we move through the next few minutes. Similarly to nurse practitioners, PAs work in various medical and practice settings and in various medical specialties. Now, unlike nurse practitioners, PAs training, PAs students don't focus on one specialty or one age or population. PAs get the broad coverage in their education, similar to nurse practitioners, but they don't focus specifically on family or acute or primary care. They have the opportunity, potentially post-graduation, to work in any of these practice settings. The large majority, or the majority of PAs now, as of about 15 or so years ago, work in subspecialty practice, but family medicine remains the #1 specialty of all PAs at about 25 to 30%, it's expected. But again, most PAs now work in specialty practice. You will find PAs and nurse practitioners in many and really all practice settings, whether it be in a hospital, a private practice office, emergency department, operating room, and other places that you might expect. So now let's sit back and focus on this. We recognize that there's a tremendous workforce shortage of those to care for patients who have osteoarthritis, perhaps other rheumatic disease, and such. One element is that NP and PA training in school, their formal training, focuses on foundational nursing and medical knowledge and nursing and medical information. And while certainly there will be elements of arthritis included in curriculum, the amount of time devoted to arthritis topics such as osteoarthritis is likely to be limited, very limited, severely limited. And we certainly recognize the opportunity that exists to help care for patients and do so in an expert manner. So to address this, again, the American College of Rheumatology convened a group, a task force, to consider ways to help NPs and PAs get up to speed as quickly as possible to help address these supply and demand gaps in terms of arthritis care. So this group was convened a couple of years ago. And as we worked through this process, one of the things that we considered is we wanted to have as wide of uptake as possible for whatever was developed. We wanted to create something that could be utilized across the board to increase the workforce of those caring for persons with osteoarthritis, arthritis, and other rheumatic diseases. So the group was convened, and you see really the group here. And I noticed that Elizabeth Schlink was on the call today, so Elizabeth could certainly speak to the process of how this occurred. But the ultimate outcome of the group was the development of a core curriculum, a curriculum that could be used to guide rheumatology practices as they brought on NPs and PAs who are new to rheumatology. And this could be a standardized yet flexible way of getting PAs and NPs up to speed as quickly as possible. We used several things. We used competencies of the professions of PA and NP profession to serve as a backbone and structure for the curriculum that was developed. I will note that the PA competencies, professional competencies, are similar to physician professional competencies and nurse practitioner competencies as established by the National Organization of Nurse Practitioner Faculties certainly are overlapping. And we noted that as we developed this crosswalk of competencies amongst the NP and PA profession. So we looked at these competencies that had been established by the profession and developed a structure for the curriculum based on that. We also completed a needs assessment survey of currently practicing NPs and PAs in varying stages of their career. And one of the elements that we learned was of the conditions that NPs and PAs treat in practice. And you really see this is a wide-reaching group of rheumatic conditions, including, of course, osteoarthritis. And this was therefore included in the curriculum. I'll quickly take you to the curriculum. This is available publicly, and you can access this. And that's really one of the values of having the curriculum in place, because it allows for wide use across various practice settings and various clinical settings as well. One of the things I wanted to show you, again, we include the elements of the competencies in this draft. We include some background material and how at least envisioned the curriculum to be used. I want to dive into very quickly, again, looking at the competencies. We structured things with goals and objectives. And if you look across the goal for patient care and the objective, it really carries that new provider across the spectrum of patient care, from obtaining the history and physical, creating a differential diagnosis, ordering laboratory tests, interpreting those tests, sharing those with the patient, and making treatment recommendations, both pharmacologic and non-pharmacologic treatment as well. In so doing, we included both adult and pediatric opportunities. We looked at functional assessments, and those were included as well. We looked at working with other colleagues, coordinating care, communicating this information to colleagues and to patients, considering health disparities, thinking about best practices such as things like HIPAA. We included things like cultural sensitivity. So meant to be a very relevant and applicable core curriculum. I'll make my way back to the PowerPoint. There we go. So this is publicly available too. You could take a look at that and hopefully apply that in whatever your setting might be. A few other elements to note about the curriculum. Again, we recognize that PAs and NPs obtain knowledge and master certain skills at various rates. We propose that the curriculum could be completed within a year, but some may complete it earlier and some may complete it at a slower pace. We recognize that practices have varying needs, and the practice could work toward the curriculum and work with the individual NP or PA at their rate, but also based on the practice needs. So in the curriculum, we established things that we thought were core or baseline that could be meant to meet meeting expectation, and then we established things that would exceed expectations. These would be things that the practice needed, but may not be needed in other practices as well. Nothing in the curriculum was meant to limit scope of practice or scope of licensure for that NP or PA. One of the elements that we could show also included a toolbox. We recognize that a practice or a location may have other resources that could be utilized to help in that PA or NP's knowledge attainment. So this curriculum was developed, and we're at the stage now where we're awaiting feedback of implementation in people's experience with the curriculum. But we recognize several potential outcomes, several potential positive features of the curriculum that could be recognized. We hope that the curriculum would create an opportunity for NPs or PAs to establish really an attitude of lifelong learning. This curriculum could be used as a recruitment tool for practices. When inviting someone to come and join their practice setting, we have a structured, planned way of helping you get up to speed in all things rheumatology. Therefore, that would allow the PA or NP to become endeared to the specialty, endeared to caring for those who have rheumatic disease. And by so doing, they would then go forth and share this knowledge with colleagues. Again, the driving force from this was to increase the arthritis workforce. And this is felt to be one way to do that. Now, unlike physician postgraduate training programs, federal funding opportunities really don't exist as we know them for physicians. Would this curriculum allow an opportunity to increase funding or provide new funding opportunities for NP or PA training? PAs and NPs aren't generally involved in postgraduate training programs by mandatory means, but there could be opportunities to develop for NP and PA postgraduate training opportunities to be developed, and therefore also expanding the workforce. So very quickly, we've described a curriculum that was developed to help PAs and NPs get up to speed in a quicker way in all things rheumatology. We briefly looked at that curriculum. I invite you to take a further look and in depth at that curriculum, at some of the evaluative pieces that are there, and the toolbox that's there available for use as well. So in conclusion, there is a workforce challenge in arthritis care and caring for those with osteoarthritis. Many other possibilities exist for helping address that workforce. I'd like to propose this curriculum can be helpful for PAs and NPs new to rheumatology, new to arthritis care. We recognize that various specialties will see patients with osteoarthritic symptoms, primary care, orthopedics, others, and this may have application there as well, again, as well as to other health professions also. So I thank you for your attention, and I believe we have time for questions if there be any.
Thank you, Ben, for that presentation. Just want to remind everyone, you can type in any questions into the chat box at the bottom right hand of your screen. And I'm going to start off the kind of discussion with a question or two that I have. So you talked a lot today about involving NPs and PAs in rheumatic specialty care. And I think you just mentioned at the end engaging them in primary care as well. So do you think there's a way to utilize this kind of education and curriculum in primary care settings to address osteoarthritis?
Yeah, certainly. We recognize that that the arthritis, quote, specialist, if you will, by specialty training would be those in rheumatology and orthopedics. But I think to be truly effective in meeting these workforce challenges, these same principles must be applied to those who work in primary care settings as well. So this curriculum could certainly be taken and applied in a practice that focuses on delivering primary care also. And that's a large part of the utility of the curriculum to be able to do those things. The standard of care for patients is the same, regardless of, what specialty setting or what practice setting we find ourselves in. So the opportunity to utilize the curriculum, I think, certainly exists, regardless of specialty, and so therefore certainly in a primary care setting.
Okay. Yeah. So very applicable to many settings and care situations.
Yes.
Great. And then we have a question from one of the audience members. Are you aware of any opportunities for PAs or NPs to earn CMEs for self-management topics?
As I think about that question on the spot, I'm not aware of any specific CME content on self-management topics. I'm sure that it exists, but I don't have anything right off the top of my mind in which to direct anyone for that specific type of content. I would be surprised if it didn't exist, but I don't have a place to send you either.
Gotcha. Okay. Does the curriculum focus on prevention and specific evidence-based programs such as the Stanford University's Chronic Pain Self-Management Program?
Right, wonderful. That would be something that certainly could be included in the toolbox. So prevention is an element of the curriculum and certainly something very needed. Pharmacologic approach is certainly important, but the curriculum also represents the non-pharmacologic approach, functional approach, and self-care, self-management, self-efficacy approach as well. That's when we think about patients holistically, the task force certainly recognized that need and certainly could be included in that experience that the PA-NP has with the curriculum experience.
Yeah, I'm curious too, just when it comes to NP and PA training programs in general, kind of before this, like as they're getting their degree, I guess I would say, does it have a focus on OA or arthritis at all? Or do you see this maybe starting to change, or is this curriculum really bridging that gap?
Yeah, so that's a great question. The vision, at least to this point for the curriculum, has been that this would be used post-graduation. Mm-hmm. In PA and NP training programs, the amount of time devoted to osteoarthritis and other types of arthritis is tremendously limited. And that has to do with the nature that these programs are done really in a condensed period of time, usually over a period of a couple of years. And so while these topics are broached, it's so limited. And of course, we who are passionate about these conditions wish that it were more. I'll give you the example. My PA school training over 20 years ago now included really 3 half days about rheumatology topics. So that means even a smaller period of that time was spent and devoted to osteoarthritis. So yes, this could serve as a model for PA and NP training programs to consider when thinking about their specific osteoarthritis curriculum. But I must say that, at least in its initial development stage, it was thought more of a postgraduate tool, but certainly there's application in the pre-graduation period of time as well, although I'm not aware of that occurring as of yet.
Yeah, we're finding with several different healthcare providers and primary care providers that there isn't a lot of, arthritis and OA time spent in school. So here at the OA Action Alliance, we have developed a primary care toolkit that's kind of geared towards healthcare providers that possibly see patients with arthritis, OA more specifically. So I think this curriculum and other tools that are being developed by us and other groups will only help with the education that providers have in providing better care to those patients.
Yeah. If you think about patients who come and see us, or patients who enroll in trials even, they have often very common themes, things that they think about. And one of the driving forces we know is that many patients come because of pain. And osteoarthritis, of course, is a pain-causing condition. And this is something that patients care about. And we want to develop expert care providers for those who treat osteoarthritis and recognize it and give it the attention that's certainly required and requested by patients for this condition that affects their living daily and their function over time.
And we've just gone over our 30-minute mark, but I have one last quick question for you, and then we can sign off for today. So do you have any kind of ideas or recommendations that any of us could take back with us to spread the news about this curriculum to our nurse practitioner and PA friends?
Yeah, so I think I would just simply extend an invitation. Take a look at the curriculum. Again, it's publicly available, and it's meant to be comprehensive. Again, expected to last a year plus or minus. But choose those elements that are helpful for you in whatever the setting you find yourself. Maybe it's in patient care, maybe it's in education, maybe it's in other factors, other relationships to osteoarthritis. And you will find things there that I think you will believe to be applicable to whatever you do in your particular setting. Again, this is meant to be recognized as a tool, as an aid to help, as we really work to address and care for those with osteoarthritis.
Well, thank you so much, Ben, for this presentation today. It was extremely informative about the curriculum and PA's and NP's role in this care and the gap between the provider gap in supply and demand. So thank you very much for that. I just want to give a brief plug for our next month's talk. While I have y'all here, it'll be in October with Heather Hodge on improving health through the WISE National Network of Community-Based Programs. So click the link in there if you would like to register for that. And I believe with that, we are concluded for today. We will have this archived on our website. And if you have any further questions, definitely reach out to us here at the Action Alliance.
Thank you, everyone.